Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Five to Thrive Live, a podcast about thriving for those who have been affected by cancer and chronic disease. I'm Dr. Lisa Schuler, and I co-host with my good friend and colleague, Carolyn Gazella. You can find all of our past show podcasts on any major podcast outlet and a schedule on our website, which is ithriveplan.com. So tonight, I'm excited to be talking with Dr. Amoz Van Dyke, who is an naturopathic physician at Sonoran University Medical Center. He specializes in integrative patient-centered care, and he has had advanced residency training in general medicine, family medicine, and pain management. He combines his naturopathic training with East Asian medicine and innovative therapies such as electroacupuncture, microcurrent, perineural injection therapy, and physical medicine. And he's focusing on identifying root causes, delivering individualized treatment plans to optimize health, to address chronic conditions, and promote long-term wellness. And his clinical approach overall reflects his commitment to compassionate, evidence-informed care that empowers patients to achieve sustainable health outcomes. So he's exactly the kind of person we want to have on this show. And we're going to be talking about fascia, which is a critically important part of our body that most people have never even heard of. So I'm excited to dive in. Before we do that, though, I want to thank our sponsors. First, we have Fascia, a patented form of glutathione, which is clinically proven to raise blood glutathione levels. Glutathione is the most important antioxidant in the body and is the body's primary defense against free radicals. And it also supports immune and respiratory health. And you can learn more at cetriaglutathione.com. We also thank ProThrivers Wellness Supplements, including ProThriver Wellness Brain, which is a product specifically for thrivers that contains cognizin for memory, focus, and attention, as well as some other brain-supporting nutrients and herbs. And you can find ProThrivers Wellness Brain online at pureformulas.com. And finally, Dr. Ohhira's Probiotics, a best-selling probiotic for over 30 years with 12 probiotic strains, all of which are shelf-stable without refrigeration due to a unique 3-year fermentation process. And you can learn more at drohhiraprobiotics.com. So with all that, hello, Amoz. Welcome to Five to Thrive Live.
Hello. Thank you for inviting me.
Absolutely. All right. I want to just dive right in, and I'm going to make the assumption that some of our listeners have no idea what fascia is and why it matters so much, especially in relationship to pain. So can you give us a little bit of an overview?
Yeah, I can. It has been interesting overall. Fascia has been explored for a while by different body workers and those things, but it is becoming more apparent in newer research about that. But fascia is essentially the type of connective tissue that fuses everything together. So it surrounds every bit of tissue that we have. It's between our muscles, it's around our muscles, it's in between the nerves, and it's often overlooked in the sense that, like even in surgeries and those pieces, it's that stringy, thin stuff that's kind of, as you peel a muscle away, it's kind of in between there. And it doesn't typically seem to really relate to function overall. However, the more and more that we find out more about fascia, what we really realize is fascia is where a lot of communication of what's going on in the body and the general health of the body, how hydrated the body is, all of that piece. Because fascia in itself, besides being collagen, is holding where all that lymph and where all of that extracellular matrix kind of exists is in between there. And by combining fascia and tissue that within the body can conduct different types of information, including electricity, in with water, it becomes almost structured water, so it can instantaneously deliver information. So where our body is in space, how much pressure we're feeling on different organs, how much different information, like how an organ overall is, whether it's secreting enough or not, and not just the hormonal feedback system, but just in general of where that space in between is. And it really is important in making sure all our muscles work, not only nerves work, but also how our organs work.
Yeah, it's so interesting. So would you say then that most pain, I mean, I would imagine you would say that most pain involves the fascia, or at least fascial dysfunction, but how about pain actually being rooted in or caused by fascial dysfunction? And if you could kind of in your answer also talk a little bit about how that might change a treatment approach to pain.
It can. So in some cases, we may find that due to a previous injury, or due to just, maybe someone had a more sedentary life, or different pieces, or even was bedridden for a while, you can get these adhesions between different tissues where they were supposed to slide and that fascia was supposed to be able to move, but now there's adhesions in there. A great example overall is a scar. A scar at the surface may actually extend all the way down to wherever was the operation that was needed. But now every time someone moves, the information transmitted from that limb or from that area is different. It's not going through, it's not transmitting the same, it's not moving the same. So it may change, especially when it comes to gain, it may change your gait, it may change your posture, and you may not even realize it because your body is just holding the position based on the information it's getting. So what we tend to find a lot of times is people who have fascial dysfunctions or areas of tissue that are not properly sliding next to each other, or that there are adhesions within a scar in there, you will find pain will be radiated differently around them, or you may have to work on how the lymphatic drainage is actually getting in and around that area that's been compressed, because normally the fluid should be able to move through that area, and when it's not, it changes the way we move, and that can increase, and in a lot of cases be the cause of certain types of pain.
So, as I said in your introduction, you blend naturopathic therapies with East Asian medicine, and you also use some electrocurrent type of techniques like electroacupuncture and microcurrent. Those are what we call frequency-based therapies. So talk a little bit about why you blend all this and how especially the frequency-based therapies interact with fascia, because I think this is, I would predict, also something that's maybe on the up and coming, perhaps, in terms of pain management.
Yes, very much so, and becoming more understood in regards to what's going on. So there have been people that have actually taken out fascial planes that are actually connected together and have noted how similar they are to either the acupuncture channels themselves and or what are called the sinew channels that are associated with these meridians or channels in acupuncture. So it always was kind of this thing that, oh, there isn't actually a structure where that's going. Oh, it must be going somewhere near the nerves and the arteries, but that's not true. It was kind of existing in between. So like I talked about when there's water in that same space, you're able to transmit information very quickly. It turns out that fascia, because of a path of least resistance, technically has seems to have a one-way directional way that it will exhibit a signal. And so when you're putting a needle through skin, which is very non-conductive and very resistant, and you get down to this tissue of fascia, which is very, very conductive, either by moving it, which creates a known piezoelectric charge and is stimulating, or even more so, putting electricity, putting electrons into tissue, is able to be transmitted very, very quickly along those pathways. And the idea is that when you're going along a pathway, if an area is deficient of energy or electrons, basically, that energy that is needed in regards to that charge for correct tissue usage and everything like that, is if there's none at the tissue, or if there's none in that organ, then as it's going through the fascia, it will go towards that area because there's less of it there. So you're almost flooding that fascial plane with electrons, and anywhere where there's deficient tissue along the way, it will gain those electrons to be able to start functioning again. And then so by using the frequency-based, this kind of goes way back in regards to some of the research that was done even back in the 30s, on frogs, and then in regards to salamanders in around the 70s by Luzon, and there was some that was more recently done in regards to salamanders where you could put a particular frequency on tissue of something that can regenerate, and you could tell a salamander to grow a tail rather than a leg by changing the frequency that was actually put in on there. And more stuff has been explored in regards to by putting certain frequencies on certain tissues, you can help it regenerate or manage. Does it need more drainage? Does it need to release a scar? Does it need to secrete more? So you can combine frequencies to be able to tell tissue actually to help improve and its function.
Yeah, so interesting. There's lots of things I could ask about that, but I'm going to move on for a moment just so that we can cover some more things. So explain a little bit more about the connection between fascia and the nervous system, because I think the nervous system is another system that people are perhaps a little bit more familiar with in terms of a part of our body that deals with electric charge and, as you say, electrons and frequency. So how does that connect with fascia?
I would say they're kind of similar. The difference overall is in regards, so we have pretty good maps or understanding in regards to how the nerves function. It's basically you have a signal, or basically like a computer, for example, the brain, either sending signals to move a muscle and or to secrete something to a nerve, to a gland. But then you also have a feedback of another wire that comes from the same kind of area that comes back that says, I'm doing my job. The difference overall in regards to nerves is we're basically kind of told the nerves are functioning or not based on how often they're firing. So for example, in the morning, I'm sure everybody has felt they put on a shirt and you can momentarily feel the shirt. Then within a matter of moments, you don't really notice the shirt anymore unless there's a tag or something that's poking you and it's irritating you. When you put on that shirt, all of the pressure sensors and anything that has cutaneous or skin innervation in there is able to feel that and send information to the brain. But the brain then interprets all of that signal as, well, was it a danger? No. Okay, let's ignore it. The signal is still technically there. You're still actually getting information continually because the shirt is still on. It's the brain is basically interpreting, okay, but we don't have to worry about that, so we'll stop making it a known thing to our frontal cortex or what we're thinking of. Now, if something to happen to change with that, if the shirt caught on something or if it tore or something spilled on it, then it would be a change in sensation, and then you would get different information. The difference in regards to how fascia is fascia also has not necessarily the same amount of, it's not like a one chord path. Again, it's a region in and around tissues, in and around muscles that is able to convey much, much faster. Most nerves can conduct very quickly. Some that are myelinated or dealing within the brain can be very, very fast. But the change in signal that can happen with fascia is almost instantaneous because, again, it's happening through almost like what's called structured water when it's within that extracellular matrix. So small, minute changes that aren't enough to note a nerve firing off are still be able to be aware. So pressure differences, even like people who have different storms moving in and those kind of things. It's always been kind of a perception of, well, what organ or what thing is actually representing that? In some cases, I think it's information we're getting from fascia. And we can use that to our advantage because we can actually create charge by moving muscles and moving fascia. Moving your fascia generates a charge that helps charge up the tissue around it. So the differences in regards to nerves is just carrying information, and it's either working, it's either firing at the correct rate, or it's firing at a rate that's high enough that now it is presented as danger. Versus fascia is continual, ongoing, and almost as expressed as some have said, it's almost like thinking of a quantum supercomputer amount of information that is being placed in, and there probably is not only one place in the brain that's actually doing all of this, unlike the nervous system. So it's a larger conceptual aspect in regards to how the body is functioning.
Mm-hmm. Yeah, it's pretty interesting. So much we don't know or still discovering, which is kind of
Still
exciting.
discovering. Yeah.
So you mentioned movement, but not all movement is the same. So are there certain kinds of movement that support healthy fascia and help heal fascia versus things that might actually make that fascial constriction or signaling worse?
Yes. So in many cases, you can kind of think of it in regards to the recovery from an injury. You need some movement to keep circulation kind of going. You need some movement to be able to get some of any of that damaged tissue, any of that stuff out. You need to flush the area out. So moving of lymph, and I'm sure there's been some talk in regards to lymphatics and lymphatic drainage, which again is happening a little bit through the fascial planes, a little bit in there. But to be able to move, you need to be able to move so that that fascia is able to slide the way it needs to so that it can communicate around that tissue. So sometimes massage, certain types of stretching using what are called eccentric motions. So eccentric would be like you're standing on something and you're slowly stretching a calf versus doing a calf raise and pushing your toes up or going up on your toes would be concentric. So you're closing or making a muscle tighter in there. But when you're slowly lowering down or slowly stretching a muscle, the amount of information you get of where your body is in space is increased significantly. What it also does is it strengthens ligaments, it strengthens tendons, and it helps move that lymphatic fluid kind of out of an area. And then a lot of that is happening through fascia. And again, if we have scars or if we have areas that haven't been able to be moved very much, you may notice more discomfort in those areas. So movement that helps mobilize tissue. So different types of stretches or different types of movement are often better.
So it sounds, this is probably one of the reasons why some people report significant improvements in pain when they start doing things like yoga or Tai Chi, because those have that kind of stretching, more eccentric type of movements.
Yes, it's stretching and elongating, and it's basically a smooth the tissue around the muscle, if it's been smooth and stretched and has been activated and either massaged, etc., is always going to feel better than a muscle that has just been lifted a bunch of weights and never not stretched again. It may be look big and strong, but it actually isn't as strong as functional because of the way that the fascia around it is actually very tight. So you just have that kind of that difference of that piece in there. And what's interesting, there's more information about not only fascial loading, but exercise too, that in rehabbing, a lot of times the exercises or movement that are needed are the ones that feel a little uncomfortable while you're doing it. But as soon as you stop or shortly after you stop, you actually notice that area feels better. That's a little bit of a trial and error versus a lot of times what it's always been is don't do the exercises that aggravate anything while you're doing it. So if there's any discomfort, don't do those, but then you'll notice that the tissue doesn't feel better after. And that's where it's kind of this, well, do you need to use the opposite muscle group for a while to see if this chronic pain that you've been having in a knee, maybe you don't need to be doing that particular type of squat. We need to do a different type of exercise to use the opposite muscle group. And then lo and behold, all of a sudden we're getting some improvements.
So one of the things that you do are perineural injections, and I'm sure that some of our listeners are not familiar with that. So I'm wondering if you could describe what that is and how that particular intervention might work alongside some of the other things that you've been talking about to reset the fascia pain cycle.
Yes, actually, we use perineural a fair bit to do a piece of that. And part of it is also with the nervous system as well. The idea of perineural means around the nerve. So these are injections using a buffered or made to be as neutral pH as possible amount of dextrose or very low amounts of sugar. And when they're introduced around into tissue that has been deficient for a really long time or aggravated a very long time, or a nerve that's been hyperactive, it bathes that nerve in the glucose that it needs to reset. And by resetting overall, then it can either resume its normal activity in there, or if there is still continued problem, it can tell us the problem. What we can use perineural for, and It's not deep injections. It's not like all the way into the knee. It's very at the surface. It's the cutaneous nerves up at the top that share information with those deep roots. And by changing those pain signals in there, a lot of times we can, one, verify that's exactly the joint or the nerve group of where the pain is, because it will be almost instantaneous, usually within 30 seconds to a minute change overall to any kind of pressure or tenderness when you're touching it, but you'll be able to feel it. It's not like using lidocaine or something that numbs out a nerve where you numb it out and it's like, now I don't feel anything. This just takes away the pain signal. But the other thing it does is putting that amount of fluid in there also opens up the space of the fascia. So you're doing kind of two different things around that. And it's very common around compressed nerves or, again, areas where people have been sedentary and haven't been stretching tissue. It can help provide not only by providing the space, but what the nerves in that tissue actually need to reset.
Mm-hmm. Interesting. Okay, so somebody comes in with longstanding pain. So what do you see in, their posture, their movements, or even maybe what they tell you, where you start to think, oh yeah, this is a fascial situation?
So a lot of times this is something I teach to the students as well in regards to, I have someone tell me overall where their pain is, and I say, can you point to it? And if they can point exactly to it and it's a structure, then you're going to start looking at a structure. But sometimes, in some cases, it's a little vague as to where it is. And if they're not pointing with their finger and they're pointing with their hand and being like, it's in this area, you can start to look at the area and see, well, does it match a dermatome? Does it actually match a nerve? Or is it following one of these meridians or fascial fields? That can be an indicator right away in regards to that. If it's like in an area that goes over, let's say down the thigh overall, and it crosses three or four different dermatomes, so 3 or 4 different nerve groups. But now you're looking at it and I know that runs all the way from the bottom of the foot up the side and then all the way up to the head. And then you can even ask, well, do you also get headaches that are on the side? And if they say yes in there, sometimes you have to look at, well, maybe their hip pain is either from all the way at the top of the chain or all the way at the bottom. So the next question is usually, well, what is the main activity that makes it worse? And if it's only when they're standing or walking, in other words, on their feet, then I know I'm going to go look at the foot and see what is going on all the way on that lateral side down by that ankle and try to troubleshoot it there. And a lot of times what we find is old unstable injuries that have gotten ignored and, oh, that's just my problem foot. But now because of their balance has been off, their posture has been off, now their back is actually and their hip are having to take the brunt of it. So a lot of times it's going back further into history and seeing associations of what is connected to what, and then we get our clue as to where we actually need to treat.
Mm-hmm. Yeah, that makes sense. Very interesting. So this is all, I think, relatively complex, and yet I would imagine that for people who feel like they've tried everything, worth investigating whether it's a fascia situation and whether treatment that's more focused on fascia would be helpful. And so if they come to you, you agree, you start working with them in all the ways you've described, how soon are they going to start to see the benefits? Is this a very slow process, or is this like immediate relief?
I would say in some cases, in a lucky few, it's a very, very immediate, like as in that day, that office visit overall, or at least a shift in an understanding of where it's coming from. Mm-hmm. In general, I would say, for example, plantar fasciitis is a common thing that we see lots of times overall. And rather than constantly treating the fascia, what I often look at is, well, how can we offload the fascia and actually trigger the arches of the foot to actually refunction again? And when you do that properly and you look at how that type of functioning is working, anywhere between a week and 3 weeks from doing a particular different type of movement, you may not have any more plantar fasciitis, not unless it's like you're really pushing on it or you kind of overdo it again. So even without any other therapies, just changing movement patterns and understanding where it's coming from can reverse it in usually in a matter of weeks, people see significant difference. With repeated visits overall in there within that time period, I would say within about a month to 2 months, most people notice a change.
Okay. Well, that's actually for people who've been in pain for a long time. That's relatively quick.
Yes.
And you also have said that recognizing joy is important in healing. So how do joy, play, positive emotions, or things I'm using air quotes, call positive emotions, how do these interface with the fascial system, and why is that important?
So along with in regards to lymphatics, the only way to really get kind of like that lymph to actually move, the only way to really get fascia to do its job properly is to move. And I think in a lot of cases, the way that we've made things in our own lives, we don't move as much as we should. So this is actually one of the more fun homework things that I sometimes assign people to do when they go home, is find something that they can do or used to do that makes them laugh. For example, if they haven't really been moving very much, they've been having some hip pain in there, but maybe doing some kind of either community group in there or anything like some form of a dance. Or if they've never done Tai Chi, try Tai Chi overall and see how it makes you feel. Or doing rebounder or doing something simple that maybe an old sport you used to do that used to make it a lot of fun, even when you were a kid, like just even bouncing up and down like on a rebounder or doing something else like that that makes you just even giggle for a moment, makes you remember an old fond memory, will do multiple things. It starts a process that you understand that you can actually move and you can have fun again. It also starts a process overall that your body will start feeling that it can move more and further each time you actually engage in it. And by finding something that someone wants to do, it's no longer going to be a chore of, oh no, I got to go to that PT again, and I always feel worse when I'm doing it, rather than like, oh yeah, I get to go do Zumba. I mean, Zumba might be an extreme for some, but just in that kind of sense that at least it can be something that is fun. And if it's social, that's even better. So walking with somebody, maybe in a particular place that you used to like walking at, or even doing simple kind of motions. And in some cases, it could be sitting in a chair and watching an old dance video or doing something and doing the motion while you're even even seated. Like just having that laughing again and just that feeling that movement in there. If you finding something that feels goofy but maybe makes you giggle, that's, I think, a great way to get people to move again.
Yeah, great. Okay, well, we are out of time, believe it or not. So 30 seconds. Any last final thought you'd like to leave with our listeners?
I would say overall, yes, we are essentially designed to move. So get up and move.
Okay, love it. Well, this has been a great show, and thank you so much for taking time to join me tonight. Where can our listeners find out more about you? Do you have a website or any social media that you would like to share?
Right now, I personally don't have any social media. However, I do know here at Sonoran University of Health Services, we do have through patients.sonoran.edu, there's information on myself as well as some other providers. And I'm working both out of the medical center itself in regards to doing some student shifts, as well as the Neil Reardon Center for Regenerative Medicine and seeing private patients.
Wonderful. Well, thank you so much, Dr. Van Dyke. It's really been very informative. And that does wrap up this episode of 5 to Thrive Live. So again, I thank our sponsors. First, ProThrivers Wellness Brain Formula, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. Ohira's award-winning shelf-stable probiotic. And just a reminder for our listeners that you can find all of our past shows at ithriveplan.com or wherever you listen to your favorite podcasts. And thank you for joining us. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.